Hi guys! Ang video na isi-share ko sa inyo ngayon is about bronchiolitis, diagnosis and treatment. Panoorin nyo guys para malaman nyo kung ano ang mga nagiging dahilan at sanhi nito at kung ano ang treatment niya. Huwag kalimutang i-like and i-subscribe at pakipindot na rin ang bell para updated kayo sa lahat ng video ko. Thank you guys!
So this affects about 1.65 million kids every year that get hospitalized, and a lot more that don't. Luckily, we are getting pretty good at keeping kids alive and preventing the respiratory distress and respiratory failure that used to cause deaths due to RSV and bronchiolitis. So what is this? Sometimes we just call it an RSV infection because that's the major cause of it, but it's not the only cause. Really what the definition is of bronchiolitis is inflammation of the bronchioles, and the clinical definition is usually just the first episode of wheezing with an infection under the age of 2. That's not pneumonia. So clinically we don't actually assess if the bronchioles are inflamed. We just assume they are if the kids are wheezing and they don't have pneumonia. So the major causes are RSV is the number one cause, but your regular rhinovirus, parainfluenza, human metapneumovirus, influenza, coronavirus. So if you'll notice, rhinovirus, parainfluenza virus, these are our common upper airway infection causes. And so you can see that it's more of a diagnosis of where we're infected and not exactly what disease is infecting the system here. So the bronchioles are down here right before we get to the alveoli. In fact, there's sections called respiratory bronchioles that are actually connected to the alveoli. Then after that, then you get your bronchioles and then your bronchi. And then of course the trachea, the larynx, the pharynx, the mouth. So the bronchioles constrict down because they're inflamed and they're already kind of small, so you get that wheezing sound. We're going to talk about these the wheezing and the other symptoms that you get here. So the story that you'll hear is this child under the age of 2 has an upper respiratory infection where they have runny nose, maybe some cough, sneezing for a couple days, and then they have this low-grade fever, a little bit higher fever if it's caused by adenovirus. And then they start to get this shortness of breath, sometimes apnea. I think it's around 20% end up presenting with apnea. But wheezing is really the key feature here. And then recurrent cough can happen for a couple weeks after the infection is already kind of clearing up. You'll see this with the common cold too. So sometimes you can just have this inflammation that hangs on and causes a cough to keep going for a few weeks. On exam, they're going to be breathing quickly in a lot of instances. You'll hear this wheeze. Usually it's going to be expiratory wheeze. And in cases where they're in respiratory distress, then you get this intercostal retractions, hyperexpansion of the chest. And here's a little sample of a wheeze, not necessarily. So that's not necessarily a RSV patient or a bronchiolitis patient we're talking about here, because that sounds like it's a inspiratory and expiratory wheeze. But that's a little bit what the wheeze sounds like. That one kind of sounded like it had some like alien noises in the background. I don't know exactly where that was recorded. But the major complications, like we mentioned, are respiratory failure. That's where you get those 500 deaths a year that we mentioned. Or you get a bacterial superinfection that leads to pneumonia, bacteremia, meningitis. For those of you who saw the asthma video, we went into a little bit of detail about whether or not RSV really causes or is associated with asthma. Well, we know that the numbers show an association, but one theory would be that kids who wheeze with RSV infection are just the same kids who get asthma, not because the RSV caused the asthma, but it just shows a tendency to wheeze. So the jury's still out on that one. The differential diagnosis includes asthma, but really we don't diagnose asthma under the age of 2, and so most of these kids are, most of the time we're calling this bronchiolitis under the age of 2. Pneumonia can have wheezing, but usually you're going to hear some lung crackles, you're going to have signs of pleural effusion. So if you're good with the stethoscope, you probably can tell the difference between a pneumonia and bronchiolitis. Also with pneumonia, we tend to have more obvious signs on radiograph, which we'll talk about in a second. So some chronic lung diseases, both congenital and acquired, can look like this. Foreign bodies can cause wheezes. One big thing to look for there is asymmetry. We remember that things are more likely to go down that right bronchus, and therefore you're more likely to have a wheeze on the right side. GERD with aspiration, heart disease, I don't know how I spelled that one, can also have some lung sounds. Vascular rings, upper respiratory infection. So really what differentiates this from an upper respiratory lesion is the wheezing. So, I mean, we talked about it's the same viruses that's going to cause it. You know, rhinovirus, adenovirus, and then potentially RSV can cause upper respiratory infection too. But the wheezing is going to be the big difference, and that's going to tell you that the inflammation is down there deep in the bronchioles. Croup, which is laryngotracheal bronchitis, that's just going to be a little bit higher up too. You don't get the wheezing, you get that seal-like bark. And then, of course, pneumonia is an infection that gets down clear into the alveoli. So we've got upper respiratory infections, we've got croup, we've got bronchiolitis, and then we've got pneumonia as you get farther down in there. So the diagnosis is really clinical. We do have tests to test for RSV, and we can also do x-rays. But the RSV testing may serve in some cases to decide whether or not we are going to use a ribavirin, which we'll talk about in a second. They may also discourage us from using antibiotics, which one could argue is a good thing. But in general, we don't need to test for RSV. X-rays are generally just used to rule out pneumonia. But once we get our X-ray, we might notice that we have atelectasis, and that will help us to determine how severe this bronchiolitis is. So when we're talking about severity, this is going to be a big factor in how we treat it. So if the baby is premature, if they have comorbidities including heart disease, especially immunodeficiency disorders, that's going to make this a severe case. If the kid looks toxic, looks real sick, if they have low O2 saturation, if they're under 3 months of age and they have atelectasis like we mentioned, that's going to put them in the severe category and going to change the way we treat it a little bit. So normally we're just going to treat this supportively. There's no drugs that we're going to use in most cases. We discourage any over-the-counter use, over-the-counter drugs. Fluids are important. a lot of people, I guess, from what it seems like, most people will prescribe albuterol in a nebulizer for bronchiolitis, which I think there's pretty good evidence that it improves the symptoms, but no real evidence that it changes the course of the disease. So one rule that you should follow, though, is if you give albuterol and it doesn't help, then stop giving it. Because if it doesn't help, then we're giving a drug that we don't need to give. In the severe cases, like we talked about on the last page, those with comorbidities, those with low O2, toxic look, these kids can be hospitalized, should be hospitalized, put in contact isolation. Oh, that's another reason we might test for RSV, by the way. If we find out that they have RSV, that might help us to divide up our patients and not cross-contaminate. Ribavirin is pretty widely contested whether or not it's an important thing to do. But we go back to the severity. If there is a severe condition and we do have a positive RSV test, then ribavirin can, in some circumstances, shorten the course of the disease. But there's no good evidence that it prevents any long-term complications. We can also do some RSV prophylaxis during the winter months, especially for some of the hospitalized kids with heart conditions and immunodeficiency conditions that would make them more likely to get RSV.
Thanks for watching.
Like,
Comments
share,
and
subscribe.